Hello, and welcome back to another episode of the podcast, which is hosted by students for students, and the guest is also students, ex students, we have our distinguished alumna from the PV Polytechnic College, SNDT Women's University. I'm your host, Taiba Momin, and today's episode is extra special as we are celebrating the incredible role of optometrists all around the world. On the 23rd of March 2025, we observed World Optometry Day, dedicated to recognize the role of optometrists. To continue with the celebration, today we have with us Ms. Priti Mistry, a renowned optometrist practicing vision therapy and specialized contact lens. With her successful clinic and a passion for vision therapy and to correct visual health, improve visual health, and ma'am Priti Mistry ma'am is here with us to share her thoughts, her experience, and her thoughts on future optometry. We welcome you, ma'am.
Thank you. Thank you so much, Taiba. It was a great, pleasure for me to be here. Like the journey is incredible. So it's my pleasure to be here. Thank you so much for inviting me.
So, ma'am, how are you feeling now? Like walking on the same streets back then when you were as a student, now as a alumna of PV Polytechnic.
That's what I said. Okay, like when I was entering the college, like premises, it was reminding me my olden days, like when I was a student, and that the dream started building up slowly, slowly while studying in this college. And today, I'm trying to fulfill each and all, the steps which formed behind somewhere. So yeah, it's a great experience. Like it's a great moment for me to be here.
Exactly. Ma'am, back then when you were getting admission here, so what led you to do optometry? Like, what was your inspiring something, or how did you lead to optometry doing it?
So the thing is that definitely I wanted to do it something in medical, but that time the circumstances was such he I was not my parents were not very keen for me to go in and do the MBBS or something like that. So during my 12th only, but I was like, I wanted to do something in medical only. So during my 12th, I met one of the past student of PVP only, like ophthalmic technology saying, and she was working with Dr. Kulin Kothari in Bombay City Eye Institute. And it just happened because she was like, she is my friend's Bhabhi, like
Okay.
sister-in-law. So we went there to get the eyes checked.
Okay.
And I saw her, and I was so happy to see her wearing a white coat. And she came, she greeted us, and she started the eye testing and all. Then I asked her, "Ki without doing MS, how can you be in this profession or something like that?" So I was questioning her, and I came to know about this course.
Oh.
And then at that time, I think PVP only was having a optometry course. Others, the HHK was started, but it was not that renowned, the degree course. So the PVP was only the one in Mumbai, basically. So it was like, okay, let me just try for this. And then after 12th, I just, took the admission for this optometry course. And then, yeah, that's how the journey started.
So, ma'am, as now your vision therapy, back then it was also it is a specialty in optometry. So, what led you, like during PVP, or what was your inspiring story to lead vision therapy?
Vision therapy, yeah. So the thing is that, like, I when I was doing this 3 years ka program diploma from this college, so while doing the internship, and like we do have a, like, still you have 1 year, third year is a internship program, right? So while doing that internship, I also got the posted in Bombay City Eye Institute only. It was just a destiny or what. It's like, the thing where from where it started, and I also got posted there only, like as a my first internship. So we do have a like six months kind
Yeah,
internship, correct?
yes,
So that
yes,
time also
yes.
we did that six months kind internship. So first internship was there, and there I was seeing like, okay, so that was the reality world, you know,
Yes, yes.
basically you are stepping into the reality,
Yes.
into the reality. So see, first few days, so I was observing, but then I started taking up the patient individually. I was doing the LASIK workup, I was doing the contact lens workup, everything they were allowing me. But slowly, I realized, ki, okay, this is how the reality
Wow.
is. So only doing the refraction, only doing the contact lens is not sufficient, because people do complain like after surgery, after they don't have a binocularity, they don't have a proper binocular vision. So that was the like somewhere the question started popping up in my mind. After that, what happened? We had a Bombay hospital visit for orthoptics
Okay.
with Mr. Ghosh.
Okay.
So he was the only one who was the like certified orthoptist who was doing the orthoptic workup in Mumbai that time.
Okay.
So then we started going there once a week. Like that, we had to go for a month. So 4 turns we had to go there,
Okay.
and we had to learn about the practical of, see, orthoptics we studied theoretically,
Theoretical.
but practical we had to study from him basically. So I used to go there, and this was like, okay, something is there which can give that good contrast, good clarity, good fusion, good depth perception, everything when you have a good binocularity or binocular single vision, you can say. So that thing I was like, okay, something I need to do in this more.
Yeah.
And then after internship, 1 year I took a break. I was like working with two ophthals I joined. Like first 6 months I was with Dr. Paritosh Kamdar, who was a retina specialist, and after that I joined Dr. again BCI
Okay.
as a optometrist. And 6 months of entire segment like did there. Posterior segment I did it with Dr. Paritosh Kamdar, and then I realized, okay, now I can go for a further like study. So then I went to BVP, and in BVP, Dipti Gokte ma'am. She is also optometrist. She's from AIMS, and she just put that kida on me, I can say. He was like, you need to study orthoptics, you need to study the binocular vision, you need to study the vision therapy. And the way she was explaining, she was like, explaining the like all the topics, and somewhere it was clicking on me. I want to do something on this, I want to do something on this. So yeah, so basically two-person, Mr. Ghosh and Dipti ma'am, two were responsible for me to be in this journey, like field. Yeah. And then after finishing my this graduation from BVP, I joined a fellowship program in Dr. Shroff Charitable Hospital, Delhi.
Vision therapy, like even I am somewhat now interested in vision therapy, coming in third year. But I feel how much of a research I have done, that the colleges like you said in Delhi. Uh, is there any similar college who apply this vision therapy available in Mumbai?
So, see, in all the colleges now, the vision therapy topic is there, like the subject is there, definitely. But practically, like if you're asking for fellowship, then I don't think so. In Mumbai, we do have a fellowship program, but definitely in Chennai, Shankar Netralaya has, this Delhi has. I think LV Prasad also gonna start, or they started. I'm not sure right now, but I heard in between that they'll also gonna start, but they have started or not, that I'm not sure. And also few private places, like people are also doing the
Fellowship program.
fellowship program for 6 months and all in Chennai only.
Chennai only. So it is very distinguished that, apart from Mumbai, in
Yes.
Mumbai there's no as such until now that they have a fellowship
No.
program. We have a subjects, but complete fellowship
Yeah.
program is not there.
So basically, in Mumbai, also the vision therapy clinic, the first vision therapy clinic, is started by me only. That is in Shroff Eye Hospital in 2012, where we were doing the binocular vision. Not see, there's a difference between the orthoptics and binocular vision. So orthoptics is basically related to the muscles of the eye,
Okay.
and binocular vision where you are like treating the brains to deal to develop the neural plasticity and develop or like adapt the neural adaptation in a newer way, and develop the fusion, develop the depth perception. Okay, so here we are not only dealing with the muscles,
Okay.
but we are dealing with the binocular coordinations with the brain, and we are changing the brain plasticity. Okay, so that is the binocular vision and vision therapy. So, Mr. Ghosh was doing a orthoptic workup and all, but he was, I don't know, like he was doing a vision therapy or not. Honestly speaking, I'm not sure. But yeah, so in Shroff we started first because so when I was doing my internship from BVP in Shroff, so Dr. Rahul recognized that I have that kida on vision therapy on me. So he just said, ki, like, let's start something. No, that way. And that's how like it started. And then the journey started. It's just keep going on like that. But yeah, it's a very, I can say it's a very good profession. Um it's like, it's satisfying when your patient gets that feed gives you that feedback, gets that binocularity, that clear vision, what they're they are going different places to place, like they like I can tell you that they definitely like do the window shoppings. They are doing, but they are actually doing the window shopping. They are going from one place to another place to another place to get that clear vision what they want to. Okay, and they don't set, they keep on changing the glasses. I don't know whether you have seen in the clinics, like they come for eye checkup and they get 5 6 glasses on your table, they're keeping, and they are like, okay, I made it from here, I'm not comfortable for distance, I'm not comfortable for near, or I'm not comfortable for XYZ, like it's that way. So, and when actually rule out, the problem is not with the glasses, the problem is with the system, and you just need to fix it up with the exercises, with the lenses, with the prism, with the tinted glasses, with the filters, depending on what problem the patient is having. Once you fix that, definitely they'll give you so much of satisfaction. By seeing their face only, you'll feel okay, I did my job. It's that way.
For the first 1 year to open your clinic own setup, so obviously opening your own setup is a huge thing back then.
Yes.
So what inspired you, and what was the initial challenges you faced in opening your own setup?
So the thing is that, see, the biggest challenge was I was not having a, like, till now I'm not having a optical counter. Okay. So to be in an optometry field, and if you do not have an optical counter, to have a proper clinical setup was the first thing I was like, I just, I'm not sure, but I feel that is the first optometry clinic in Mumbai who doesn't have a optical counter. Okay. So the biggest challenge was definitely the to generate the incomes, or the like basically to generate that what you can say, patient trust was definitely there, because if the patient is doing a window shopping also, but patient can sense, patient can feel that, and the way you are doing, the way you are approaching, the way you are doing all the different tests, and the patient, from history also you can make out, and by your question, asking your question to the patient will come out with the few hidden problems which patient also was not aware of. But by your experience, when you ask the patient, okay, do you feel this also? Do you feel, like, say, common example if I can give you, see, parents always comes and complain, ki my child is very dull in study, or he is not focusing in study, he doesn't want to copy only, he's not copy from the board, he doesn't know like to read, he's just avoiding, he's a lazy child. So sometimes you must have heard that parents label the child. Okay, the thing is that it's basically it's I like, by doing this therapy more than like 13 14 years 15 years 14 15 years. So the thing is that I realized this is not the child's problem, they are not doing this purposely. This is like because they can't focus,
Right.
because their both eyes are not working. Just a simple thing, because
Mm.
of the convergence insufficiency, they can't maintain the binocularity for longer,
Right,
so they
right.
don't like reading. After 10-15 minutes, definitely the one eye will start deviating, or one eye is getting more pressure, so definitely they need to take a break.
Right.
So they'll get up, they can't study for 2 hours at a stretch because of the convergence insufficiency. So it's not the child who is lazy,
Hmm.
but because of the situation he is becoming lazy, and he is not preferring to read or to write, or because of the poor oculomotor functions, they are skipping the lines, or they are not copying well, they are not following the lines properly because of the difficulty in pursuits and seconds.
Right.
So the thing is that, through your experience, basically you ask the questions to the parents, ki, do you feel, see, it's many time it happens to with me, that after assessment, like initially they say ki, we just came for the regular checkup,
Routine.
or my I feel ki my child is complaining about the headache, or my child is complaining that he or she can't see from far,
Far.
so we just wanted to do the routine checkup. And through, like when you go through the assessment, and you realize कि, okay, these readings are so lacking behind,
Yes.
so that means the child is definitely suffering from this. And then you ask the questions to the parents, कि, do you feel your child is skipping the letters, or skipping the words, or skipping the line while copying, while reading? And they say, ha, he is very lazy, he or she always does this. So your
Yeah.
assessment itself
Itself.
says that there is a problem, which maybe throughout the history and all didn't come out from the patient, because parents has accepted that my child is like this.
Like this. They feel that the parents feel that the child doesn't want to study, or he's not interested, not
And he
doing
likes to do
homework,
more outdoor
outdoor
activities or something
Right,
like that. So this is what, like, basically, so parents, when they see you, how you are working, no, you definitely gain the trust. But only the challenge which I came across, that nobody was knowing what is a optometry clinic is.
Right.
So to develop that term and to get familiar with the layman or the local public, if there is a optometry clinic, something like that is existing in this world, is bit challenging. Then second was like, to get the patients. So the thing is that we have a little the people, like for example, for laymen, doctor means ophthal, correct? So they go to the ophthal, or they go to the optician for eye checkup. In between, optometry is existing that no one knows, basically.
Right.
Correct? So they either go to the optician or they go to the doctor.
Right.
So this was, the gap was always there
Right.
in between. So to build that bridge in between, that there is a optician, there is a optometrist, there is a ophthalmologist, was little tough.
Usually people consider optometrist as the something like only for glassing prescription glasses.
Yeah.
So they find it in an optician also. So they prefer that, like,
Correct,
that's
correct.
just
Yeah.
for glasses. So why to spend money and stuff? And if there's
Yeah.
major things,
And usually they do free eye checkup.
yes.
So
They even does not do comprehensive, and
yes,
people
yes,
don't know
it's just
that eye
a
checkup is a
yes, correct.
comprehensive test.
Yeah. So, like, after coming to this field, like after doing this fellowship in vision therapy and all, the refraction is not a just
Right.
this done.
Right.
It's way beyond than that. Like how the first of all, the AR is just like, I feel it's just a additional aid which gives you a rough idea. That's it.
Right.
But to do your retinoscopy, to do check the glow, the intensity of glow, brightness of the glow, and all, which is very important.
Right. And it is very important for people also to understand, like, on basis of AR or just from refraction, you cannot determine what is the eye health.
Correct. True. Very true.
So, ma'am, how do you put up on this? Like, optometrists play a crucial role in early detecting of eye disease, or maybe any eye condition.
So the thing is that, see, we are a primary care
Right.
professionals, correct? So we are the first one in during your preliminary examinations only. You can rule out, okay, there is a something. and then you can refer the patient
Patient.
to the ophthal accordingly. Like if like you can suspect if the patient is having glaucoma, patient is having any retinal disease, patient is having any early cataract changes or early lens changes. You can see the pupil and you can make out is there any RAPD or any abnormality in the pupil reflection reflex basically. So there are many things which on the primary examination or in the during the preliminary examination only you'll come to know, and then you can refer the patient to ophthalm.
Right. So there is a important role of an optometrist in between, like there is early detection. If have you ever come across any such cases, like early detection had made some good result out of it?
Yeah, definitely. Like this was a very scary one, definitely. You know what? Like one of the patient who came walking during the lockdown only to
Right.
my clinic. Okay, and she was a young girl, and father was a rickshaw driver. He got her to my clinic, and he was like, "I don't have a money
Right.
to pay because lockdown is going
Lockdown,
on."
okay.
I was like, "No worries." So he was like, "Okay, but they were having online
Online
classes."
classes.
So he was like, in that online classes, she's not able to focus well, and she's complaining about the headache and all. So and she was not wearing any glasses, so it was the first time. Okay, so we did. I was finding a little refractive error, but I was finding the glow was not the regular glow. So, like basically, we work hand in hand, basically. Okay. So there was a one definitely I always feel that you and Noftal has to work hand in hand.
Right, right.
That always I feel. Okay. So I just like one of the Aftal who just came finishing his fellowship and came, and he just called me that particular moment only. He's like, "Can I come and see your clinic or something like that?" He said, "Guys, just stay opposite to your clinic." So I was like, "Okay, okay, sure, you can come." And I just told him, "Ki I have one patient right now. So, but I'm suspecting something on the retina, which is like not looking normal,
Okay.
something fishy, you know." So I just told him, "Ki, can I dilate and can you come and see?"
Right.
He said, "Okay, give me 1 hour. I'm just having my lunch and I'll come." I said, "Okay, meanwhile, I'll just dilate this patient." I did dilatations, and I was just seeing uh, with that 78D on the slit lamp. So I was doing the fundus examination and I found something kind of tumor or something, kind of, okay? But I was not very sure because I have not seen those kind of patients in personal, is a person, but I have seen those pictures on the definitely
Yes, yes.
in the books and all. So I was not sure to label it definitely, but I was very scared. And then that Hoftal came, sorry, and he was like, "Immediately do this B scan, this scan, MRI of the brain and all and all." And that child diagnosed with the blastoma, retinoblastoma.
Okay. So
It was a like later, like not the blastoma at that stage, definitely, but later, sorry to cut down that. It was not a blastoma, it was a tumor in the retina, but later it may turn to this.
yeah, major condition could be.
And the girl was a 8 to 9 year old only.
Okay. So this is the role that early detection plays important role
Very
here.
important role, yes.
So, ma'am, if you could break down what is vision therapy exactly is for a normal human to understand, for like optometry student to get in fellowship in optometry in vision therapy is somewhere we know that vision therapy exists, but what exactly it is, and it's just that exercises or what is it?
So yeah, so the basically vision therapy is a like uh, first I'll tell you, okay, before going for the vision therapy, first I will tell you what is binocular vision.
Right.
Correct. So when the binocular vision, now as a student you know what is binocular
Right,
vision.
right.
So binocular vision, when you have good binocular vision, you won't have a astropic symptoms or any other symptoms like hazy vision, blurry vision, diplopia, those kind of like uh, difficulty in focusing and all.
Right.
So when you have a good binocular vision, you have a good 3D vision. You have a good 3D vision, so your life is set. Now, if you have any abnormality in your binocular vision, like you have a difficulty in changing the focus, like difficulty in accommodation, difficulty in convergence, maybe you have a excess of convergence or insufficiency of convergence. So in those cases, you have a symptoms like diplopia, like double vision, blurry vision. You have a symptoms like shaky visions. You have like patient feels heaviness, astopia, tired eyes, fatigue, XYZ.
Right.
Yeah. So to treat that, there the first thing, so definitely you need to do the good refraction.
Right.
That is the your first thumb rule. Okay. After that, to treat that, you plan the set of exercises.
Right.
That comes under vision therapy.
Vision therapy.
Second thing, to give the glasses, with glasses, additional some lenses required, some prisms required,
Right.
some filters you require. Those things comes under the vision
Vision
therapy.
therapy.
Okay, so there are different streams also in vision therapy.
Okay.
Like one is you are just treating the binocular vision.
Right.
Second, you are treating the all the difficult patients, difficult cases like traumatic brain injury, post stroke. So when you have a
Trauma.
brain injury or like concussion or a blunt trauma or a accidental brain injury,
Right. Right.
so in that time your brain shakes
Okay.
and basically the normal, the pathway which are connected with each other gets disturbed.
Right.
So I'm speaking in very layman language right now. Okay, not too much in the medical terms. So basically in layman language you can say your brain shakes and your all the neural pathway which are connected to each other gets disturbed.
Okay.
And definitely you'll have some or the other issues.
Issue.
Like for example, I'll give you one common example. Okay, first I'll just finish with the streams. So that is the neurovision therapy. In there, the neurovision therapy comes because you are dealing with the nerves, neurons, right? So that is the neurovision therapy. Then you have a behavioral vision therapy in case of like special childrens who are from the spectrums, who are like from Down syndrome society, who are from ADHD, ADD. For those children, you need to do the behavioral vision therapy, where you need to change the behavior, you need to develop their cognitive skills, you need to develop their visuomotor skills, you need to develop their basically the visual processing.
Right.
You have to develop their visual processing skills. Correct? So that there it comes the behavioral vision therapy. Then we have neuro rehabilitations.
Okay.
So in case of basically recently I'm having a one patient with Parkinson's.
Okay.
Now you'll get surprised. Okay, what is the role of vision therapy in case of Parkinson's?
Right.
Correct? But what is a Parkinson's? It is a central nervous system disorder.
Right.
Correct? Where your brain's nerve cells are damaging day by day. So nerve cells are connecting with the eyes also.
Right.
Definitely, then slowly. See, depending on which nerve, like which area of the brain nerve cells are damaged. If it is in the occipital area, definitely. And see, the one more thing just came in my mind. We think occipital cortex is only responsible for the vision, correct? But your reading and your cognitive skills or your like perception skills are coming from the frontal lobe.
Yes.
Correct?
Correct.
Your parietal lobe is also responsible little bit.
Yes.
Correct? So when your imagination comes
Right.
and all, so different part of the brain is working and helping to have a good vision. So it's not only your occipital cortex is working. You got my point?
Yes.
So if any injury to one particular area, because the pathways are traveling.
Right.
So if any injury to one particular area will affect some or the other parameters of the eye. So right now I'm not talking about the only 6x6 vision. I'm talking about the functional vision, which requires, if your vision is 6x9 or 6x12, patient is fine, but they should have a good functional vision.
Right.
Like good contrast, good depth perception, good oculomotor functions.
Right.
Correct? Because in day-to-day life, anyways, you are not gonna see 6x6
Exactly.
every time.
Right.
correct?
Correct.
But you should have a good accommodative facility.
Hmm.
You should have a good virgins facility.
Right. Agreed.
You should have a good central vision, good peripheral vision.
Right.
That all comes under the vision therapy.
Great. Because obviously people consider 6 by 6 vision is only that important, or because that's the only thing they see through glasses. तो चश्मा इसी के लिए चाहिए कि हाँ 6 by 6 दिख रहा है, okay, everything is clear, no other eye condition, and no, nothing is needed. That's what a person's perspective.
Yeah, so here one like very good case, it's just came to my mind. One of my patient who was a artist in drama.
Okay.
So like they have to perform live. They are not in front of the camera, correct? So they have to be a very like spontaneous in that
Right.
speech and all, correct? Now, you know what was the condition? He went to 8 ophthalmologist places, different, because he was not satisfied with the thing. And each and every place he got the answer that your vision is 6/6 N6, young artist, like 22-year-old artist, come model, okay? And he went to different places to get his eyes checked because he was not happy with his reading abilities. Okay, so he found that something is wrong in his eyes, and he's while reading the script, like when they get first script. So when you're reading first time, he was lacking behind with his co-artist.
Okay.
Okay, then 2-3 times he'll read, then he'll mug up.
Okay.
Okay, then the flow he gets, and then he's par with the co-artist. But first 2 times he was really struggling in reading. He went to different places to get his eye checked. Everywhere, everyone was telling, okay, you are 6/6 N6, you don't have any problem. This is your psychology. This is a psychological issue. You just start telling yourself you are fine, you are fine, you are fine. Okay. Then he came to the us, and he got referred to me.
Okay.
Okay, just do once binocular vision assessment for him because he is struggling and he has a bundle of files.
Oh.
Everywhere he was just collecting the files. Okay, normal. But he said, I'm not normal, I know that. You know, sometimes you can
Yes.
feel that difference. So he came to me, I did the assessment, and in assessment, his pursuits and seconds were very bad, especially his pursuits. So pursuit is his following movements. So the following, like when he was reading, he need to use his hand. He was not able to read thoroughly without hand movement. Like eye movements were very poor. Then I said, okay, we'll try. Like I'll do the 10 sessions with you. Mostly in 10 sessions you'll be through. But in case if your body is responding little slower, then we might need to extend few sessions. He was like, okay. You know, till now, I am getting the free passes of dramas. Till now, he was like, you gave me the new life.
Right.
You know, he was like, you are a blessing for me. I went to, and it's like, you know, since a years he was struggling.
Right.
And he was like, you gave me this new birth kind of things. Now I'm like, I don't feel only I had this kind of problem in past.
Right.
And in return, he just, like, you know, he just couriers me.
Right.
Like, this is the new
Free
drama
drama.
coming up. Please come and have a look. I was like, okay. Like, so,
Sweet gesture of patience.
yeah. So it was that way. Even one more patient, I just would like to mention that patient is from, he was an IIT student, final year IIT student from Powai. Like, Powai we have. Yeah, Powai. So you can imagine that IIT student, how much they study and all, right? And now this guy read the nystagmus pe 4 books.
Oh.
4 books he read on nystagmus only because one of the doctors said, okay, you have nystagmus.
Okay.
And you know, sometimes you manifest.
Yes.
So he manifested himself into the nystagmus zone. So whenever he's reading, he has to tap his foot like this.
Okay.
Or tap his hand on like a leg like this, and then only he'll be able to read.
Oh.
To create that nystagmus.
Nystagmus.
And when he just read some reviews from Google and he came to my clinic, and he was like, I'm having a nystagmus. I was wondering where is nystagmus.
Like,
I'm seeing. I'm trying to find out the null point. I'm trying to find out what kind of nystagmus having. There was no nystagmus. Only there was a jerky movements
movement.
because of the poor like seconds. It was very and the poor fixation.
Right.
There was no other thing. I was like, 10 to 15 minutes. I was like, he's telling me he's having like history of nystagmus,
Nystagmus.
and nystagmus doesn't just disappear like this.
Right, right.
Definitely, the intensity reduced, the frequency reduced. Definitely, maybe the patient adopts the null point, so you
Right,
see the
right.
very amplitude reduced, but like it never disappears. And I'm like, where is the nystagmus? Then we did the therapy with him,
Right.
and he got such a good score in his final. He
Right.
got very good job also. He gave such a good review also.
Right.
So it was like, okay, so basically the thorough examination
Right.
and this, so vision is 6-6 only in both the cases, 6-6
Right.
and 6, but
The function is
vision was
upwards.
like, they are affecting, like he was like, I cannot read without
Right,
this.
right.
The other guy was like, I cannot cope up with my co-artist,
Right.
So that's the thing. So there the vision therapy
Comes to
comes.
play.
Yeah. So it's as I mentioned before also, it's a very satisfying job,
Right, right. So vision therapy, does it have any specific age limit? Like, does it works for only adults or only for children's or
So I
anything?
have a patient from 3 months old. It's like CVI,
Yeah.
CP patient, like cerebral palsy, cortical visual impairment patients. For middle age, I have for like all the autistics. In the normal cases like lazy eye, minor intermittent squint, or phorias. So those kind of patients. Till I have like the oldest patient which I had before was 86-year-old uncle who developed the intermittent exotropia, and he was driving so good in his whole life, and because of this intermittent exotropia suddenly he developed, maybe it was there before and gradually it increased and then increased, and when he came to us, his angle was like around 65 prism diopter uh, exo. So in that case, like we started with the therapy because 86-year-old already the all the reflexes are deteriorating slowly and all. So we started, and the son after like 2 months or 2.5 months, the son sent me a video on my WhatsApp that he was driving back.
Right.
And the day when he came first to my clinic, he was taking a baby steps
Okay.
because he was so scared that he'll fall because the peripheral vision disturbed because of XT, exotropia. So peripheral vision was very much disturbed. He was not confident enough. So he was like, touching the wall and taking up baby steps. And when we slowly, definitely his confidence improved. He started crossing the road by himself. He was not taking the help of his son. So son was always coming and giving us like feedback. Okay, Papa started doing this. Papa started doing that. And the day when he sent us the video of that he was driving, and uncle was so happy. He got his life back. So there is no age limit,
Right.
in short.
So vision therapy, that now in newer technologies, vision therapy and optometry is evolving. So what you feel that how does this newer technologies come into vision therapy, and does it how you are excited, or what is your point of view on this newer technologies coming in?
See, definitely the newer technology is helping because, like, we can see many new softwares are coming up in field and even in vision therapy. So they are like kids-friendly softwares. Even the sometimes, like, see, if you are 80 years old, if you are 60 years old, no matter. Somewhere you also have a small child, sitting within you.
Yeah.
So when you get those kind of characters, so you also feel like little funny, definitely, but little joyful to perform the task.
Right.
So it's so definitely that new technology is helping with the softwares and all. Even the many new technologies are coming up with the eye trackers and all and all. So which really helps for us to diagnosis the particular disease or particular disorders or particular problem with that you can show it to the patient also.
Mm.
Before you were assessing and you were finalizing, okay,
Final.
this is the here now you can show it to the patient. Like for example, if I'm telling you about the eye tracker, so you can show that how many times child or he or she has jumped, not following the line correctly, the fixation is roaming here and there, for example. So you can show and the patient can correlate that thing and can
Work on it.
work on it, like
Right.
okay, that is true, okay, I'm having a this problem. So
Problem,
you
right.
basically you'll get the data on paper,
Right.
which you can show it to
Right.
the patient. So that way also it's helping a lot. Yeah, and simultaneously now newer technology in the VT only, like in vision therapy, I can see the VR, virtual reality is also coming into the picture. So patient has to wear that, and they are doing the exercise for 6 meters, like 4 meters, 3 meters, depending on where you find the patient is having a trouble, you can adjust and you can make them
Right.
do.
So does it has a good results? As in.
Yeah, so in that case I can say definitely with the software technology or with this
Yes.
artificial intelligence, you can
Yes.
say in that way, like with the use of that you can improve at certain level.
Hmm.
But then definitely you need to do the office exercises
Right.
or home exercises in the free space,
Right.
because your reality or your real world is the free space.
Right.
You are working in the free space, you are not working in that bounded area.
Agreed. Yes.
So later you, like at certain level definitely it helps, but then to get into the real picture, you need to do few exercises which should be like in related to your outer space, like your free space.
Right. So, if you look back, and how would you say that PV after passing out from PVP, then doing all of your journey, how has PVP shaped your career? Any thing that have still stuck in your mind?
Definitely, like PVP is the first, you can say the first step of mine.
Right.
So definitely it helped me. But the one thing, like our HOD was Dr. Anita Adappa, and the Kavita ma'am was there as a optometry in charge.
Right.
So she like saw that spark on me or what, I don't know. But she was always key, you can do much better than this. So she was never satisfied with my score. She was never satisfied with whatever. You can do better than this. You can do better than. And now she feels so proud, so
Right.
proud. Like the way, like whenever I'm achieving something, I do share with her. Whenever if she'll come to know from outside also, okay, I got this or I achieved this or I did this course or something like new. So because this journey is still on.
Still on,
Like last
right.
weekend also I was in LV Prasad learning the speciality, like from Fit Academy. I was learning the speciality contact lens, but more like advanced in scleral lenses.
Okay.
So the journey is still on in study. So like whenever I do share with her, she gets very like not happy only, I can say she feels proud.
Right. Right. So speaking about this patient and your journey, so I have seen you in many conferences, attending lectures, giving lectures, then, and like you said, you have a private setup. So how do you balance this, like your work plus being updated with the technologies, then attending conferences and everything?
Yeah, so the thing is that definitely it's a big responsibility, definitely, yes. But yeah, you need to keep upgrading yourself because there are many new things is coming up, and if you can, adopt those new things or new, for example, new instrument is coming up or something, and which can help your patients to treat in a better manner, then why not?
Right.
That is my perspective basically. So I always keep updating myself what best I can give to my patient or what easy way I can provide that environment to my patients so they can improve and they can have a better healthy life or better healthy vision.
Right.
Because vision is, like, if you can say, 90% of your information to receiving or going to your brain through eyes, receiving through eyes.
Right.
Definitely you use other organs like your sensory organs, but that at limitations.
Right.
But like if you're not doing anything, you are just sitting there, but you keep observing and keep sending the information to your brain. So the eye plays, both the eyes yours plays such a crucial role, and we are in such a noble profession.
Agreed.
Yeah, to treat that eyes and give them a wonderful, like,
Right.
vision where they can see such a great
Great
world
work.
without any trouble or without any compromised.
Right.
See, definitely few patients develop that compromised vision as a normal vision because they
Right.
have not seen that norm. What is a normal vision? So for
Right.
them, that is the. But once you have an opportunity to give them that normal
Hmm.
visions experience, then why not?
Right.
And for that, if you need to upgrade, then why not?
Agreed.
It's that way.
Great.
So definitely, it's a big challenge to maintain that
Hmm.
clinic. But I have a optometrist with
Okay.
me who are like taking care in my absence,
Okay.
and we plan the basically the if the patient is
Okay.
coming, then what all exercise. So
Hmm.
we always plan. Then we do reassessment every
Right.
after 5 sittings or 10 sittings. We reassess. Then again we change the plan.
Okay.
And this is step by first you improve this, then you
Right.
improve
Right.
this, then you improve this. It's like that.
Right. So, as you said, you keep on balancing and planning. So, do you engage in community outreach or any programs that spread awareness? Also, if we speak like, we have just observed World Optometry Day. So, how do you think it plays a role of spreading awareness to people to do regular eye checkups, or it also like optometry also exists, and what role does it play?
So in that case, I feel that now people started getting aware about
Right.
definitely about the optometry term, that optometrists are existing. Especially in overseas, if you see, there was not a big issue,
Issue.
but in India, definitely yes, people were not very much aware. But through the social media, through the different platforms, they are getting aware of this.
Right.
Second thing, I feel in all the schools, they started doing the eye camps in
camps.
younger age
Right.
of for children.
Yes.
So that also really helping to create the awareness.
Right.
The optometrists are going and doing the eye camps and all and all. So they are creating the awareness.
Okay.
And nowadays parents are also very much educated and smart enough.
Right.
So they also do the Google search before coming to you. So they also like pretty much aware about the term
Yes.
optometrist and all. Like,
Agreed. Like in the world of like, keep on phones and screens. So
yeah,
it is there, and that you get not only glasses, you have conditions.
correct.
Correct.
So
Right.
that's how they are doing.
So as optometry field is coming into play, like it has been evolving and getting importance. So how do you feel? How do you tell the upcoming students to, how would you inspire them or could encourage them to take up the field of optometry?
So, like, if you are very passionate to treat or to give one step better life than what they have, whoever is suffering basically to them, then definitely you can opt for this profession, because this is a, again I said, this is a very noble profession.
Right.
Where you, as a primary eye care, you have a chance to see, to observe, to assess the patient. And the thing is that refraction is not only इसमें दिखता है ये अच्छा है. Refraction is way beyond. If you are very good in your subject, if you are very good, thorough with your knowledge, and you know how to implement that knowledge and where to implement, no one can stop you.
Right.
That's the thing, basically.
So moving on to this session, we have a interesting part, this and that question. Like it's
Okay.
a segment where you choose in between the two questions and just a line of maybe a description or something. So ready?
Yes.
So the first question is either spectacles or contact lenses.
See, in this, I cannot choose one
Right.
because it always depends on the condition
Right.
first. Second, the need. What the patient need is demanding, and what condition patient is having.
Okay.
So it's very difficult to choose. But if you ask me as what I prefer. So I prefer, you can see, spectacle
Right.
definitely.
So next is eye strain or blurry vision.
Eye strain or blurry
Blurry
vision. But if you have a straining eyes, then you might have a, so what I have to select in this?
So anything
Or I
like
have to explain.
yeah, anyone if we could see with what happens like in an eye strain and blurry vision are two different thing or
Yeah, definitely, both are different things. Eye strain you have because of different reasons, like maybe overuse of your near work, or gadgets, like I can say overuse of your gadgets, or you have a eye strain because of some underlying pathology also, or you have a eye strain due to uh, lack of sleep and all. Blurry vision you have for many reasons, maybe because of some pathology on the cornea. Blurry vision you may have because of the some abnormality in your lens accommodative system. Blurry vision you have because of retinal pathology. So there are many reasons for it, right?
So next question would be vision therapy apps or like physical clinic session.
If you ask me, physical clinic, because see, why I always prefer, because we are working in the free space, which is very much necessary. Whatever you do in that closed environment, but the patient has to go to the physical environment or in the free space. So they should have a special awareness, and that you can develop with the physical, like office environment way. The second thing, app. Now in app, you don't know the how far the, for example, if any child is working on the app, parents will feel कि we bought this software, now my child will be normal. Now you don't know at what distance the child is working. For example, child is having a lazy eye, okay, whether child is having an anisometropic amblyopia, for example. Now the whichever eye is an anisometropic eye, that eye is an amblyopic eye, correct? Now, if the child is not wearing the glasses and doing the exercise, and which eye he is using? Good eye. First thing, what distance child is? If the child is going very close to the screen and doing the exercise, that means child is at comfort zone. So he won't improve it from the lazy eye. He's not allowing that eye to work beyond her or his capacity. Correct? So basically, here you need to pull the child out of that comfort zone and do the activities, so you can eliminate the part of the laziness.
So in short, that guidance is important to use a particular
So
apps or something.
yeah, and which environment he's using. He's switching off the light and doing the software. So many parameters you need to take care of, which we don't know at that place they are doing or not.
So clinical visit could
Because that is under your observation, and the main thing, as I mentioned, that special awareness, which is very peripheral field. If you want to develop peripheral fusion, how will develop in this? You cannot.
So next would be sunglasses or hats for sun protection.
Hats is completely different, but first sunglasses. That is secondary. But first for eye protection, sunglasses.
Vision therapy or patching?
That is a very good question. I really love that. Seriously. So patching is an old book theory, which is a very conventional method. Definitely, people are using nowadays also, but you know, every time you have to revolve or evolve yourself. Correct. So you have to keep evolving with the new with the new understanding, with the new you can say okay, like comfort and all. For example, if I only tell you, like for 1 hour, so basically people used to do patching for 6, 6, 8 hours. Full time patching. So I just tell you, just close your one eye and sit for 1 hour only, not 6 and 8 hours. Imagine your brain will be so irritated, because you are just stopping the one full field of vision. So I would never recommend this. This is my last option where the patient can't afford the normal like we work basically MFVF. MFVF is a like monocular fixation in binocular field. Means your binocular field is open only, where you are allowing that lazy eye to fixate more and more. So with the help of software, with the help of that, you must be seeing that glasses, red and blue, red and green, the anagloves. So that anagloves, or maybe with the help of software, with the help of like different, like sometimes we do one different refraction also. One eye we give full correction, one eye we undercorrect. Like that also we do. Then sometimes, so in that case, patient has to make two glasses. Sometimes this like 2 to 3 hours that adjustment glasses, and otherwise the normal glasses. So they have to make two glasses, or we do like give them a partial patch. We give binasal occlusion, we give many things like basically. So to develop the peripheral fusion, to develop, so we work that way. So in vision therapy, we focus on that MFVF, we focus on the binasal occlusion to develop the peripheral fusion, we focus on the basically to eliminate that suppression. Like for example, if the patient is having anisometropic amblyopia or strabismic amblyopia, patient will have partial or full suppression for sure. So that suppression you have to eliminate. Till the time you don't eliminate that suppression, that vision won't improve. So you must have heard that. Ki parents are saying, we did 6 months patching, he improved 2 lines, and then again he went. Because the suppression is not eliminated. You got my point? So in vision therapy, we do that. So the patching is not the first line of treatment. It is a, considering the situation and all, it is a last line of treatment. The first line of treatment is like vision therapy.
So next will be Snellen's chart or log mark chart.
Depending on the availability. But I prefer logmar more. But yeah, there's no like any difference. Yeah.
So logmar or vision screen, like the newer, this is, everybody is having this digital screen where the charts are visible. So what do you prefer, the logmar physical chart or the
But
screen?
if the screen is also like calibrated properly, you can use it. Because in screen, the advantage is, one more advantage is there. In case of amblyopia, they do have a crowding phenomenon. So to avoid that crowding phenomenon, in that you get the single test types also. Like yeah, only one letter. So that will, like, you know, so then even in the case of autistic children and all, that really helps to check the vision. So you'll get a rough idea about the what is the vision, because you know, in that you will get the pictures chart also. In that you will get a single optotype also. In that you get a linear optotype. Even you can do sometimes if the patient is having a some kind of a scotoma. So in that you can show them vertical, you can show them, so different settings are there. So if that is calibrated properly, definitely that's a good option.
So software based vision therapy or manual based vision therapy?
I think that I already answered. Yeah, of course, manual based.
So ARC coating and the spectacle or blue block?
ARC.
Do you have any further plans to expand your clinic or to take a new project? Like, what are your future goals?
Definitely. But yeah, I was restricting myself for this year because of some family commitments, because my son was in 10th grade. So I was focusing more on him. But yeah, definitely. But yeah, definitely I do have a plans to expand and open one more branch.
So we are eagerly waiting for it, or seeing the branches across all Mumbai.
Let's see. Hope for the best.
So if you could go back to the like, you know, back times, initial time when you were a student, what advice would you give to back then to yourself as a student, like in this field, before even starting your career?
So like, I didn't get you. Like, I need to advise to the students or myself?
As a younger child when you were back then. So what would you have given as an you know, encourage maybe, or advice? What advice would you have given to your younger self?
Keep working hard. Keep focusing and keep working hard.
We have a very great session with Miss Priti Mistry. And I'm very glad that our PVP students and everybody looking out there would learn and have many takeaways, definitely. Also, aspiring optometrist, you have a lot more to go.
Yeah, yeah,
Right.
yeah. Like you have a way long to
Long to
go
go.
ahead, definitely. And I would like to say to all the students who wanted to be a part of this journey, or who wanted to call out themselves as a optometrist, is like, just give your best, do your best, and put your 100% efforts and knowledge
Right.
into the
So,
reality. That's it.
ma'am, if other like you, if viewers want to see more of your work, where would they find you out more of your work, or if they want to contact you or anything?
So the thing is, I'm available on social media, definitely,
Right.
like Facebook and Insta.
Okay.
LinkedIn pe I have a profile, but yet I'm not using that much because I'm also still learning.
Learning.
Like I'm learning on those
Right.
parameters. And my contact number is always like
Yes,
with you
we
guys,
could.
so you can definitely
Yes.
share. They can email me. My email
Right.
ID is also with you, so they can like WhatsApp me, email me. So I'm available on many
Yes. So you
like
could say your
platform.
this social media ID or
I'll share it.
okay. So thank you so
So
much.
yeah,
It was a very great session, and everyone out there, keep your eyes healthy. That would be our go-to maybe idea.
yeah.
That's it. Thank you so much.
Thanks everyone.